This child's mom brought him into the ER saying that she thought he was having an allergic reaction, but the labs told a very different story. This is an NCLEX case study. I'm going to give you a patient presentation that goes with this picture. You're going to decide what the disease process is. I have 2 additional questions for you to answer and a bonus question at the end, so don't scroll away. All right, this is a 4-year-old male. He has paraorbital edema, so that's edema around the eyes here. He does not have urticaria or pruritus, so no hives and no itching. His blood pressure is 82/62. He does have anasarca. Anasarca means they have generalized edema kind of everywhere. His labs show that he has hyperalbuminuria or massive proteinuria. Albumin's a protein, so he got massive proteinuria. Based on that, what disease do you think this kiddo has? Based on what he looks like and the case presentation, you'll answer in 3, 2, 1. This is nephrotic syndrome. In nephrotic syndrome, the nephrons or the glomeruli of the nephrons become really damaged and they allow things to come out that shouldn't, like albumin or protein. All right. So your next question is, what 2 lab findings do we see in the blood that would indicate that this kiddo indeed does have nephrotic syndrome? You've got 3 seconds to answer. 3, 2, 1. That is going to be hypoalbuminemia and high triglycerides. So because this kiddo is peeing out all of their albumin, massive proteinuria, hyperalbuminuria, then they have very little albumin left in the blood, which would give us hypoalbuminemia. And that's why he is so puffy, because albumin keeps fluid in the vessels. And since he doesn't have any in the blood, then he's going to get really puffy and get that anasarca and this paraorbital edema. We also see high triglycerides. All right, this is very, very important to note for nephrotic syndrome. All right. In nephrotic syndrome, the patient does not have a lot of albumin. The liver's job is to make albumin, so it's working overtime to make more proteins, including lipoproteins, which are our triglycerides. So you will see that. Next question, what is the drug treatment of choice for a patient with nephrotic syndrome? You've got 3 seconds to answer. 3, 2, 1. This is going to be corticosteroids. Usually we're going to use prednisone, and they're going to be on these for quite some time. All right, here is your bonus question. What is this patient at high risk for? These patients are at high risk for this. This is something that we can do with nursing to prevent this. 3, 2, 1. They are going to be at high risk of infection because not only are they peeing out albumin, but they also pee out immunoglobulins, so their immune system is going to be compromised. Plus, we're going to have them on long-term corticosteroids, which we know can cause immune deficiency. Did you get this case study right? Let me know in the comments.